Hi, Medical Squad. My name is Jacqueline, and welcome to my channel, Medicalology. Today, we'll be covering cardiac anatomy. We're going to go over the different chambers of the heart. We're going to know what is the most anterior portion and what is the most posterior portion. And also, I'll give you guys the best mnemonic to get you these free points on test day, okay? So, let's get started. I have 3 questions. Number 1 is on the shorter side, so we'll read the entire question, but as we move on to question 2 and 3, we'll see how I approach these questions, okay? So number 1, a patient involved in an automobile accident presents with a sharp object puncture of the middle of the sternum at about the level of the 4th or 5th costal cartilage. If the object also penetrated the pericardium and heart wall, which heart chamber will most likely be damaged? So in this question, they're trying to get us to understand what is the most anterior portion of the heart. So here goes my mnemonic. So here, we have to draw a box. We're going to draw a square. We have 4 chambers. And we're going to draw in the first one, which is the right atrium, right ventricle, left atrium, left ventricle. We're going to draw a line between the right ventricle and left atrium. We're going to draw 2 lines next to the esophagus. And we know that this is our esophagus. So we know that the left atrium is next to the esophagus, okay? So next we can just highlight the right ventricle and the left atrium. So these are the 2 ventricles that chambers that we are discussing. So we can cross out what? Right atrium. And we can cross out left ventricle. Okay, so here they're asking us which heart chamber would most likely be damaged, right? So they're asking us what is the most anterior. So when we drew this line, right, diagonally, the right ventricle through the left atrium, which one did we hit first? We hit the right ventricle first. So the right ventricle, A for anterior, L, A on the left atrium is the most posterior. So it's the most posterior because we hit that one last. We hit the right ventricle first, right? So then this question, they're asking us what is the most anterior portion? The most anterior portion of the heart is what? The right ventricle, okay? So let's move on to question 2. So this one is a little bit on the longer side, right? So it says that the patient has palpitations. She immigrated to the United States from India. That's not really important. I wouldn't say important, but if you know this is a first order question, if you look at our answer choice, this is just first order. So we don't really need to get into the details. We need to know what is high yield, because when we're taking exams, when we're taking STEP, also when I took my medical school exams, we are timed. So we have to think critically and we have to understand we are timed, that we have to use our time wisely, okay? So here it says the barium esophagram, which is important, demonstrates extrinsic compression of the mid-esophagus, right? Enlargement which of the following is most likely to cause this patient dysphagia. Dysphagia is another word for difficulty swallowing, right? So we're hinting. They're hinting esophagus, right? Esophagus is in the questions then. So we can draw in our box, right atrium, right ventricle, left atrium, left ventricle, 2 lines, E. What is that? E stands for esophagus, right? And in our line, it shows that the right ventricle and left atrium. And what is most posterior? What is most posterior is what? Left atrium. And what is next to the left atrium? Our esophagus, right? So here they're hinting that the esophagus is being compressed, and what chamber of the heart is what is closer to the esophagus? The left atrium, okay? So the answer here would be what? Left atrium. So we can cross out right ventricle, we can cross out right atrium, and we can cross out left ventricle, okay? So question 3 on the longer side again, but we're going to read the last 2 sentences and see if we can pick out the high yield details, okay? So I said the patient is conscious but in distress. Not that important. Physical examination, this is high yield. So whenever you guys are going through a question STEM and you see physical examination, I want you guys to draw your eyes there because that's where the money is. So the physical examination shows a laterally directed anterior chest wall stab wound at the 5th intercostal space along the left midclavicular line. Which of the following structures is most likely to be injured in this patient? Okay, guys. So you already know. Let's just start. Let's start drawing our box, right? I'm drawing our box. Right atrium, right ventricle, left atrium, left ventricle. Draw a line. Right? 2 lines, esophagus, right? So in this question, they're asking us what is the which structure is most likely to have been injured in this patient. So our knee-jerk reaction, because we see anterior chest wall, right? If we see anterior chest wall, we know that, okay, med squad taught me to do the box, and what is most anterior, which would be the right ventricle, right? So our knee-jerk reaction would think that the answer is right ventricle, but that is wrong. And let me tell you why it's wrong. It's wrong, and this is a tricky question because it says physical examination shows laterally directed, right? Laterally. So if they would have said medially directed, medially would have been right ventricle, right? But because they said laterally is for lungs, okay? So I always want you guys to remember that lungs equal laterally or lateral. L for L. And the heart is medial. Okay? So because it says laterally, the answer is left lung. Okay? If they would have been medially, so they could have just switched just one word, right? One word to medial, the answer would have been right ventricle. Okay? And we can eliminate the others. Okay? Remember, when you're taking your exam, make sure you use your cross out tool. UWorld has it. I believe your school has it. If not, just remember to cross out the answers that are distractors. So one thing I wanted to mention the CT scan. Okay? This is a CT scan. And we know that's a CT scan because the bones are appearing white. And so we're going to have to understand that this is anterior and this is posterior. And we should know that this is anterior because this is the sternum and this is the vertebrae. The vertebrae is showing us that that's the back. You know, our vertebrae is along our back. So again, if we understand the boxes, right? The boxes that we made today, this portion here is our sternum. This is the vertebrae, right? And they're asking us, if I would have gotten stabbed, right? I would have gotten stabbed right here in my chest. They're asking us, what is the most anterior portion? What chamber would be affected? If you look at that, if I have a knife and I'm stabbing somebody, look how you go straight into the right ventricle area, right? And also, if you look at the esophagus, right? Look at the esophagus and the left atrium. They're so close together. So if the left atrium is enlarged, right? If you have cardiomegaly, the left atrium is going to compress on the esophagus. So that's why when you have cardiomegaly, or if you have anything that's messing up with the left atrium, the esophagus is going to get messed up. It's going to get affected first, okay? So that's why when your left atrium is enlarged, the esophagus is going to be affected. And that's why the patient was presented with dysphagia in question number 2. Okay, and guys, I just want to go over one more time the box. So whenever you have questions, these are first order questions. You have to get these questions right. Remember, just to draw your box, right? You're going to do right atrium, right ventricle, left atrium, left ventricle, draw a line, 2 line, esophagus. You already know. So now if they ask you, okay, what is the most posterior portion of the heart? Left atrium. I know that because I drew my box. You don't even have to write in right atrium or left ventricle. If you just remember the diagonal, right? If you draw your diagonal, you remember that the right ventricle and the left atrium are like diagonally together. You think about it, you have your 2 lines next to your left atrium, so you know that the left atrium is next to your esophagus. Okay guys, that's the end of my video. Thank you guys for watching. If you have any questions, please let me know. And hopefully this was helpful and you can answer your questions. And remember, you're smarter than you think you are, and definitely go with your first choice, okay? Bye.